morning, we were above 18 million cases and 689,000 deaths from COVID-19. In the United States, we are now above 4.6 million cases and 154,000 deaths. And really the pace of growth in our country and around the world is pretty sobering. The United States is adding over 100,000 cases a day and over 1,000 deaths a day at this point in time. It's a very sobering point in the pandemic for all of us. Here in Minnesota, we had yesterday an additional 622 laboratory confirmed cases that we're reporting today, bringing our new total to 56,560 cases in Minnesota. So since Friday, there have been over 2,000 more cases confirmed. So in addition to the 622 on Sunday, there were 721 cases reported on Saturday and 760 on Friday. The median age of our cases remains at 36.0 years old. There are 302 patients currently in the hospital, 153 of them in intensive care. We've been noting and feeling grateful, as Chris says, over the last few weeks with a declining hospital census. But as we have been saying, with the increase in cases, we do expect that to translate to increased hospitalizations over time. And in fact, there's now been a 19% increase in the number of patients in the ICU and a 5% increase in those in the other acute care beds, medical surgical beds, just over the past week. Testing volume yesterday was 15,868, and we were over 15,000 tests for the prior 2 days as well. We've had a 10.4% increase in total testing volume versus a 9.2% increase in new positive cases measured from week to week. The 7-day rolling average test positivity rate for Minnesota hit 5.0% over the weekend and is at 5.1% now. So it does continue to move up over the past week. We had 2 additional reports of COVID-19 deaths yesterday, bringing our total to 1,616 of our fellow Minnesotans who have died from COVID disease. Yesterday's deaths were 1 each from Anoka and Dakota counties, 1 person in their 80s and 1 in their 70s. Neither was a long-term care resident. I'd like to talk a little bit more today about compliance with executive orders. Between July 10th and the end of the month, we have received 370 complaints through our Environmental Health Division about potential bar and restaurant violations, including 24 on Friday. As we hear of events like the rodeo in Itasca County or reports of the Sturgis rally going ahead later this month, it's again important that we remind everyone that the impact of COVID-19 on our schools, our businesses, our families and friends is largely going to be determined by the decisions each of us as Minnesotans make. While healthcare workers and public health workers are working hard and can do a lot to prevent the toll of COVID-19 in our state or to mitigate it, they can't do it alone. They can't do it for us. We all need Minnesotans to do our parts. And we thank the great majority of people who are doing just that and paying close attention to social distancing and mask wearing, avoiding large crowds and close gatherings. We ask everyone, and even especially those who might be resistant to taking these measures, to understand that every time each of us makes a decision that makes transmission more likely, we're really holding back the rest of our state from moving ahead toward reach. With that, I'll turn it over to Chris Erzman for some comments.
Thank you, Commissioner. In late July, the federal government issued a call to action for plasma donations from people who have recovered from COVID-19. It's called convalescent plasma. The reason these donations are important is that people who have had COVID-19 develop antibodies to attack the virus that can be found in their plasma. And this plasma is being evaluated by a number of researchers as treatment for patients with serious or immediately life-threatening COVID infections. Our COVID-19 research studies in Minnesota webpage includes links to some locations in Minnesota that are doing this type of research and are looking for study participants. Organizations include the Red Cross and Memorial Blood Centers and others. If you have recovered from COVID-19, please consider donating plasma to help aid in this research so we can find effective treatments for this disease. And as we've said before, for everyone who can, we also want to put in a plug for people to donate blood, as there is always a need for maintaining our blood supply. And as we've said, our blood banks have made efforts to make donating very safe. I'd also like to talk about scams, unfortunately. We continue to hear about scammers taking advantage of people's anxiety around COVID. In the last few days, for example, we've received reports of a fake letter or bulletin made to look at it as if it was issued by the CDC containing disturbing guidance about the use of masks. This is not the first that we have heard about fake information being developed appearing to come from an official institution. We've received a number of emails about fake get out of mask free cards posing as official MDH certificates being used at businesses and restaurants. However, this is the first time that we've seen someone posing as a federal agency. One of the most disturbing parts of this fake message is that it seeks to confuse people into not wearing a mask when it would be especially important to do so. We're particularly concerned about a section that appears to direct people that dry cough, a well-known symptom of COVID, is a sign of micromolds in your mask and warrants its disposal. We also warn people to be aware of scams related to contact tracing. If you have been exposed to COVID-19, a public health worker will first reach out to you by phone call, not by text. They will never ask for credit card numbers or money, or for your social security number. You can report COVID-related scams to the Minnesota Attorney General's office. And with that, I'll turn it back to Mike Schoen.
Thank you, Chris. Operator, we're ready to take questions.
Okay, so as a reminder, to ask a question, you will need to press star 1 on your telephone. To withdraw your question, press the pound key. Again, that is star 1. We do have a question on queue from Jeremy Olson from the Star Tribune. You are now live.
Hi, thank you. Looking ahead, it appears increasingly likely that we will someday at least have a vaccine against COVID, but we're unlikely to have enough right out of the gate to serve everyone who wants it. As with remdesivir, I'm wondering if, as a state, we're starting to think about how we are going to ration to distribute the initial doses of vaccine we get, knowing that it'll outstrip the demand, or there'll be less than the demand.
Jeremy, hi, this is Jan. This is a great question, and I think it might be a good topic for a future media call to learn more about something called the Minnesota COVID Ethics Committee, which is a group of ethicists working with healthcare providers and with us in public health to develop ethically based guidelines on resource allocation. And actually, this is something Minnesota has really been leading the nation on for probably 20 years now. There have been really robust discussions between the clinical community and the ethics community and community-based organizations diving into these very questions. So it's really timely and probably be a good thing for us to talk more broadly about that group and its work. There's also a science advisory team that is kind of connected to that ethics review process that gives us the best of their input as well on what we know about resource allocation through a kind of a scientific lens as well as an ethical lens. With that general description, Chris, do you want to comment a little bit more specifically on vaccines?
Sure. Just a couple of things. One is that in general, the broad guidance for vaccine allocation comes from the Advisory Committee on Immunization Practices, which is a federal CDC group. And so they historically have made that guidance or that prioritization known. I know I was a member back in 2009-10 during the pandemic, and so we put out guidance for prioritization of vaccines. With the COVID vaccine, the president has also asked the National Academies of Sciences to develop a group that will also be evaluating the situation and providing guidance on prioritization. But, as the commissioner said, that guidance will come to the state, and then it will be our responsibility to implement it and to make it specific to Minnesota. So there are federal groups that will provide us with broad background on prioritization, and then we will make it specific for Minnesota. We have begun planning for COVID vaccination, and in fact, the CDC has invited Minnesota to be part of a pilot group that will be looking at vaccine planning. So one of 4 states that will serve kind of as leaders in the country. We were selected because of the strength of our immunization program and because of our history of outreach to various communities. So we have actually started planning, even though there is not a vaccine that's readily available at this point.
And my follow-up is, implied in my question was that this would be a unique challenge. I know we've been through swine flu, and there was some prioritization of the vaccine doses made available in 2009, 2010. This would seem to be on a whole other level, though, but that's an assumption on my part. Are you assuming this to be a pretty big challenge that you're facing coming up?
We recognize that it will be a challenge where we need to vaccinate the entire global population, and that's why we've started the process, and I think that's why CDC is interested in working with a few key states to begin to think through how we'll do this. But I do think it's important for people to think about as we move into a time when there's a vaccine, which we're all very much waiting for, is that it won't be a situation in which there will be enough vaccine for everyone right away. It will be a process, and so people need to be aware that that will be the case.
Thank you.
Next one on the line is from Minnesota Public Radio, Catherine Richard. You are now live.
Hi. Yeah, I was hoping first you could comment on a statement Dr. Anthony Fauci made today, I believe to JAMA, talking about different states in the Midwest that should be considering dialing back their reopening measures. Minnesota was included in that list, as well as Ohio and a few others. What do you make of those comments? How would you react to his assessment?
Well, this is Jan. I didn't hear those comments, unfortunately, but I certainly understand the point that when you're seeing growth such as we have been, and we certainly do compare data and compare notes with our federal colleagues on an ongoing basis. I think we've heard more consistent messages from Dr. Fauci, Admiral Brett Giroir, who is the Assistant Secretary for Health, Dr. Deborah Birx, and they're just sort of increasingly focusing on taking very seriously what's going on in the country and really encouraging local decision makers to act preventively. And we certainly think that we are doing that and looking very closely at our data, trying to calibrate our responses to where we see the strongest evidence of risk, for example. And have really been, as you know, we've been talking about reinforcing the critical importance of complying with the existing guidance. We do believe that if what we're seeing in the case investigation reports is a lack of compliance with the existing guidance rather than the insufficiency of the guidance itself. But as we said before, we are going to continue to monitor these data, and we've been a little more stable in recent days than might have been the case. I mean, we're not seeing, although I hesitate to make any particular predictions about what might happen next, but we've seen kind of a fairly stable level of new cases, albeit at an unfortunately high level in the 700 range. But it's not continuing to grow beyond that. So it gives us a sense that we have a little bit of time to watch our trends here. But Chris, anything you would add?
No, I think that I would agree with what you said earlier, that when we hear these comments from the federal level, it's not a surprise to us. That's why we keep reiterating. That's why the commissioner's comments talk about the role that we all have in making sure that we're following guidelines. That when our case numbers go up and when we see those challenges with increased cases, increased use of ICU, then that is the recommendation that we're hearing, is that we should be closing things down. And we don't necessarily want to do that for so many reasons, but we need people to be aware that that is the recommendation that's coming from our federal partners.
So just to follow up, slightly separate note here, we hear a lot about clusters from you guys. I'm wondering if you could offer any detail or insight into what you're hearing from the casinos in Minnesota, whether you found any clusters connected to casinos, and also clusters connected to sports teams, like kids who are playing sports this summer.
Chris, could you take that?
Sure. We have reached out to our partners in the casinos. We have not been hearing about clusters associated with casinos. And with sports teams, what we tend to see is, an isolated case here or there, but really the majority or the bigger transmission that we're seeing has to do with social events sort of following a sporting event. So in other words, a whole team goes to someone's cabin for a weekend, or a whole team goes out and does something social. So we're seeing less transmission that's directly associated with sporting activities, and more that's associated with the social that accompanies.
Okay, thank you.
Next one on the queue is from Carol Evan, Carla Holt. You're now live.
Thank you so much. Regarding your comments about Sturgis, I just honestly literally returned from an interview with a biker who is already planning his route and will be attending. He says that several in his motorcycle group are also planning to go. He's already heard from folks in the community at the Sturgis event that it seems to be business as usual. They're planning similar numbers, a slight decrease perhaps. But given that, how concerned are you about what this event may do, its ripple effects? And could a quarantine result in terms of where you recommend that people who do go ahead and attend this Sturgis rally, should they come back to Minnesota, should they quarantine?
Well, certainly, this is Jan. Yes, we are concerned with any large gathering, sustained contact of that nature. Is sort of a recipe for something to happen, and in South Dakota it has seen its spikes as well. So it's not like they're going into an environment that has no risk. So yes, we're concerned about that. We would expect we might see cases here in Minnesota from that. Later in August and into September. I think we've not yet had the discussion about quarantining or requesting quarantine of people coming into Minnesota from out of state travel, but it's an interesting suggestion or question about this particular event, one way or the other. But we'll keep you posted.
And if not a self-quarantine, is there any other sort of precautions, preventative measures that they can take? As again, I want to just add on to that I talked to several Harley dealerships as well, and they're seeing a huge number of people headed west. So again, recognizing that people are doing this, is there anything in addition to wearing masks and that sort of thing that they can do beforehand and then afterwards? I mean, do they just monitor the symptoms if they're not being asked to self-quarantine? What sort of advice do you have on that front?
Well, we definitely would want to encourage people to be aware of the risk environment and be aware of, perhaps some of the events that are associated, maybe not doing quite so much congregating as is typical. And definitely, yes, self-monitoring for symptoms and considering getting tested 5 to 7 days after the event because of the very real potential for spread. But Chris, would you have anything else to add?
Yeah, I would just, as you said, I would just emphasize that individuals who, participate in the event should really, when they return, if they aren't able to, self-quarantine, to really limit their additional, social activity. And particularly if it's someone, they should be very cautious, particularly if you work in an environment or you're engaged in an environment where there are vulnerable individuals. So, yeah, all the things that the commissioner said, and just to be really aware that you're mixing not only with large groups of people, but with people from all over the country.
All right, thank you so much.
Next one on the queue is from Carolina as well. Emily Haddock, you're now live.
Hi, Jan and Chris. Good timing for this question because I want to ask about the rodeo. Any updates on cases related to the rodeo? Have you seen anything else through contact tracing?
This is Chris, and I'll just jump right in there. We have not seen additional cases, although we are continuing to monitor for that. I believe it was just Friday that we identified the first case, so we will be monitoring for additional cases, but none at this point.
Is there any concern that because it's a more rural area and because of the population and the idea that it was sort of a protest, it sounds like from some of the communication, is there concern that people won't get tested?
Well, certainly. Oh, go ahead, Jen.
No, I was just going to say that is always an interesting potential issue. What would lead someone to be concerned about getting tested? Why would they not? Why would, especially if they develop symptoms? We certainly would hope that people would prioritize their health and that of others over any concern about giving any validity to the cautions that were expressed about the event. But Chris, what would you add?
Yeah, no, that I was going to say that we hope that no matter how people feel about the various guidance that we've put forth, that they would focus on their own health and knowing that there was a potential for exposure at the event if they start to develop symptoms, that certainly that we would encourage them to go in and get tested, really for their own sake. In this case, unlike wearing masks to the people around you, getting tested is really for your own sake. Make sure that you know what you have and that should you develop more severe symptoms, that your healthcare providers can treat you appropriately. Thank you both.
For the next one, we do have Darren Svensson from Cato Radio. You're now live.
Thank you very much. There's been a little bit of a talk about COVID-19 developing into some long-term issues with the lung damage and et cetera for people that even have recovered from COVID-19. Is there any way to track the folks that have recovered from, say, March and April from COVID-19 to see if they're developing any long-term care? And if folks are in the recovered category, does the state continue to monitor those situations at all?
I'll turn that one to Chris.
There is, well, a couple of things. We don't continue to go back. So in other words, when we interview a case, we're interviewing them kind of in more real time. We do go back and do an in-depth review of those individuals who have been hospitalized, so we do chart reviews there, but we do not follow an individual case for the duration of their experience with COVID, because with 56,000 cases, that's just not possible. However, what you've described is something that we are concerned about and is being looked at on the broader national level. And so we may be asked to participate and go back and do some interviews, with selected individuals who have, already moved forward from their infectiousness with COVID to look at what long-term, issues they may have. But at this point, that's not part of our current case investigation process. As I said, we look at hospitalizations, we do an in-depth review, we review deaths, but it's very likely that we will be asked to participate in something that looks more in-depth at what would be counted as, and I say this in air quotes, an average case of COVID, because there is evidence to suggest that there may be more long-term consequences than what people may think.
Is it way too early to really determine if it's a major issue, knowing the fact that most people are only recovered for maybe 2, 3, 4 months as of this point?
Yes, you make a very good point there, and that is that we're just a few months out from all of the cases that have been identified in Minnesota. So it is a little bit early, but there is data suggestive of the fact that having COVID may have more lasting consequences than people may have initially thought. And so we may or very likely be asked to participate in some studies that go back and look at cases to evaluate that.
Thank you.
We do have a follow-up question from Jeremy Olson. You're now live.
Hi, I've been meaning to ask this question following the school's announcement, and that has to do with the subject of aerosols or the spreading of virus through the air as a means of transmission. Has there been much consideration of that as a risk in the schools versus, the person-to-person kind of projecting of droplets? And if so, how do you confront that potential additional risk?
Great question, Jeremy, and I'll start and then ask Chris to add on. I think that's kind of part of why, as we know that there continues to be new studies, new debate, a continuing debate about this particular point around the role of aerosolized spread. That's kind of a big part of why we keep saying we will make the best the best judgments, the best advice available based on what we know at the time. Always acknowledging that as the pandemic progresses and as knowledge increases, that those recommendations could change from everything that we know to date, including our own experience with our Minnesota cases. That's what led us to the recommendations that we've made at this point. But it is very important to always stay open to new evidence as it emerges. Chris, what would you add?
Yeah, I think that the issue of aerosolization of the virus is something that has been on everyone's radar for a while, and so while we're there, there's different perspectives. I think those are all things that we were considering, and that is why looking at the ability to be socially distanced, which we recognize is not possible in some situations, and why our guidance then is that we would want to see very, very little activity in the community in the situations in which we'd have kids coming together where we couldn't socially distance. That's why the recommendation for staff and students to wear masks, to source control, all of those things are in an effort to take what information we have and look at a critical part of our infrastructure and see how can we meld the need to make sure that kids have the best education possible, but can do so in the safest manner.
And my follow-up question to that, I believe the Minnesota State High School League is meeting tomorrow with a likely trying to set return to play policy for high school teams for the fall. Have you given them any direct, have you said this is what we think you should do, or any guidance that they'll use for their decision making tomorrow?
I know that members of our team have met with them and provided them with input, as well as, we have broad guidance for sports as it relates to all the various, different types of sports, and then with links to national guidance and things. So we provided them with input on lots of different levels, including staff who have had conversations with them.
You can't characterize what those conversations were, what you're telling them to do.
I was not the person that was part of the conversations, but I can tell you that our biggest concern is, how we can allow students to participate in sports in the safest manner possible. And that's really challenging. And I've said before, I've got a number of people that I care about very greatly for whom the ability to participate in sports this fall is really important. But even with that, we want to make sure that the guidance that's provided is what will be the safest for them.
Thank you.
Operator, we have time for one more question.
Okay, so for the next one, we do have Chris Megan from Pioneer Press. You're now live.
Hi, I wanted to ask a follow-up question about contact tracing. We've heard from a couple of different readers that when after they talked to somebody from the contact tracing team, they were sort of confused as to whether or not they should be telling people they were close to and in contact with while they were contagious, whether or not they should be informing folks that they contracted COVID-19. Can you sort of walk us through a little bit about how the contact tracing works and who gets in touch with people who were close contact with someone who tests positive?
Chris, can you take that?
Sure. If let's say that I develop COVID, so the first thing that happens is I will be interviewed, and the interviewer of the case. So from the individual who is originally ill with COVID, and then from that, they will look at, are there people, direct contacts that we need to reach out to who may have been exposed in a manner that means it's likely that they could have had transmission of COVID. And for those individuals, so there's kind of two different messages. So if you are the case, we're calling, we're finding out where you've been, who you've been exposed to, and obviously we're reiterating that the message that you need to be isolating yourselves and staying out of circulation. And so then if I say, I have spent a lot of time with Jan Malcolm, and I think that there may have been an exposure there, then the contact tracers would, contact Jan and talk to her about that potential exposure. Now, I know that I have COVID and I need to isolate. In the case of the commissioner, she has been exposed, and so their guidance would have to do with telling her that she should be quarantining herself or keeping out of, contact with other people. Now, does she need then to go ahead and start telling other people right away that she's been exposed? She certainly can, but she at this point doesn't have COVID. She's just been notified that she's been exposed to it. And so if people are curious, if I get a call that I've been exposed, do I need to tell people? You certainly can, but at this point, there's not much that they can do because you have not yet tested positive. We don't have information about symptoms on you, when they may have started, or if you don't have symptoms and you test positive, we don't have your test date. So it's a situation in which you kind of have to wait a little bit to get more information if you're actually the contact of the case, because without that, you can certainly tell people if you're comfortable sharing that information, but it doesn't give them something definitive that they could take action with.
Right. So if I test positive for COVID-19, the contact tracer that I talk to would likely reach out to anyone who is at high risk of being affected from me. It wouldn't be something that I necessarily had the responsibility to inform them of.
Right. They will reach out, and certainly, you know, if you are willing to do it, that is great because you will be you actually know how to reach your contact. I mean, you'll be more likely to have a direct contact with them. They'll probably be more likely to pick up because you're their friend, you know, all of those things. But yes, we do follow up. So if someone is not comfortable doing that, yes, we will follow up.
Okay. I just asked because we had heard that maybe was not happening in a couple of instances, and I was just wondering if there's any reason why that would be the case.
What was not happening? That we were not reaching out to contact?
Right, or that people were basically dissuaded from reaching out to their contacts or told that it wasn't necessary.
Well, I think that, you know, we are reaching out to those contacts, and it may be that whoever they talked to on the phone thought, you know, we have the information, we'll be able to answer their questions when we reach out to them. But certainly, you know, we wouldn't say you can't tell people. It helps to make them be more aware of their situation.
Okay. Thank you, Chris.
Yep.
That's all the time we have this afternoon. If you had a question we were not able to address during the call, please feel free to reach out to the MDH Communications office this afternoon. Have a good day. We'll be back with you again on Wednesday.